Well, welcome to another episode of Healthy and Active in the Couve. I am personal trainer Nick Medlock, and with me, as always, is physical therapist Trent Corey. And we're going to have some fun. We're going to talk about some neuropathy things, maybe drop foot, some different modalities to help with that, maybe some different outer extremity weaknesses, kinds of things, maybe some causes and potential therapies or exercises that can help. But let's just open it up. I have many clients that experience neuropathy, and I'm a personal trainer, so I can't diagnose and I can't technically treat for certain therapies, but I do have corrective exercises and core exercises that do aid along with physical therapy. And I have many clients who have reported back to me that some of the things that I've helped them with have changed the nature and quality of their neuropathy in their legs and feet, and if not totally eliminated it if they continue to do the exercises. So let's just open it up even more. Trent, what is neuropathy?
Oh my gosh, Nick. So we have a lot of things neuropathy just means any sort of pathology with the knee or with the nerves, right? So just trying to get a signal to that area, is trying to transmit a network signal to that. Nerves need blood and oxygen and movement to that to happen. And a lot of times there can be deficit to any of those things that bring life to the nerve, and then it can really create decrease in sensation and difficulty with circulation kind of goes with it. We
Mhm.
see a lot of diabetic neuropathy folks who have a lot of issues where all that tissue is just not getting the blood flow, and then it's kind of killing off the nerve, and then you don't have sensation. So they kind of go hand in hand, right? So blood's nerves. I think about in our brain, it's like only what 3% of our body weight, and it's like takes 20% of our energy. And that's the thing, same thing with the nerves. Nerves need a lot of energy, and a lot of times they get either entrapped or there's some sort of issue with circulation. So I've seen it quite a bit, and it's something where you see those folks with diabetic neuropathy, their legs look kind of red and hardened, and it's kind of a rough situation. A lot of times it can go into a situation where somebody actually needs to amputate
Yeah.
because it's literally kind of dying there. So it becomes a big problem because we have a lot of folks who have maybe they could literally just step on something and not know it. And bleed forever until oh yeah, you got a big nail stuck in your bottom of your foot, like they wouldn't even know, which is very scary. One thing we want to make sure we work on is to improve things. And our sphere is so great because we can actually exercise and move and improve our sensation of that. And then, trying to work on things that we know. For example, my soft wave machine can has actually been gangbusters for this condition, actually, because it kind of helps pulse that wave into those areas, break down any scarring tissue restrictions, increases angiogenesis, which is blood vessel growth and blood flow. And so it's been work. It does work very well for that. It's something where I usually use soft wave mostly for the extremities and for joint issues, but the literature is kind of showing how that's actually pretty good for the neuropathy thing. So that's kind of my angle from it. There's a lot more to it, but obviously it's not something I work on directly, but it's something where I always have to consider it as part of if someone's got that condition, and how much and how severe, how much we have to play to make that work, get the best outcome of what they're aiming for
Yeah.
better function.
I haven't had much experience with the diabetic aspect of that,
Yeah.
but I do have a lot of clients that have it seems like it stemmed from a vertebral kind of impingement, kind of a thing, like with maybe stenosis or I'm blanking on it right now, where the lumbar pushes forward.
Yeah, you get like a lumbar protrusion or some sort of spondylolisthesis
Yeah,
or any sort of little joint restriction. That's kind of like a lumbar radiculopathy. Any
yeah,
sort of like exiting nerves from your back, L3, 4, 5, L5S1. People have heard these disc levels because those are the nerves that go into your leg.
yeah.
Typical one is the sciatic issues, but they do originate in the low back. And then anywhere along that pathway from your low back
Yeah.
into your SI joint, into
Mhm.
your buttock area and down the back of your leg. Very common area. We sit so much, it causes a lot of pinchment there. But a lot of times it has to do with the shift in your spinal alignment.
Mhm.
But also, another thing that I've learned from Dr. Ryan Welton, who's a gifted physical therapist in Florida, and I've learned a lot of cool things from him, is how there is a referral pattern from the SI joint itself that creates pain patterns that look very similar to that of like a sciatic nerve tract
Yeah.
issue, and it's actually not maybe coming from there. So we can work on ways to gap open the SI joints and help that. And if that's the case, oftentimes the symptoms can decrease dramatically just because something's stuck. And usually it has to do with one of those ilium is either up or out flared. And so it's causing a jam position. So we're trying to open that up with doing a special maneuver that we do. And then we solidify that with motion. So we try to make sure that's cleared too. Like if those things are a factor, then we can clear that and make sure you're moving better with less of that stuff happening.
Yeah.
So
And also the something I've experienced with many clients, if they've already been working on the spinal stability and the SI movement, just even like foam rolling, or I use a lacrosse ball also like on the peroneal nerves, which like the sciatic runs all the way down through the like the super
yeah,
peroneal nerves, and a lot of foot movement, just like we always talk about, if I can get their feet to move, I can get a little bit more stability.
yeah,
And for me, it just sounds like a lot of different motions that you can get blood flow into that area could
mhm,
help with the neuropathy because the nerves need blood and the muscles need activating. And the more we can move, the more the healing can happen. So
yeah,
why I think for some people, working out with a trainer might have some different benefits, whether it's just the movement is the benefit, and then seeing a physical therapist and doctor for actual diagnosis, knowing what things are, and if there's like a true nerve impingement that might not be what a personal trainer can see or know. Just working in synergy always is helpful, but for my aspect as a trainer, I've seen a lot of people improve with movement and core stability and just in general. And when they stop, the type of neuropathy that my clients typically experience are like the tingling and sometimes the sciatic kind of shocking nerve pain kinds of
yeah,
things.
yep.
But motion is motion.
Yeah, no kidding. And it's the right kind of motion. So that obviously when you're doing work with them as personal training clients, you're making sure that they're not overdoing and then not causing things to rack way deep into pain. A little discomfort's okay, but nothing's too sharp or too zingy. Those kind of things are just general considerations. And yes, in general, most people with good movement and with that, just that guidance, just to not be afraid of movement and just move through things, actually things get better than if you just completely rest. And there is a time for rest or relative rest or decreased time movement, but a lot of times we can move through those things and feel a lot better. And so, yeah, that's a big thing. So those are good. Yeah, definitely a big part of the whole process is making sure that we are active and moving and that you have some guidance through somebody having a trainer with you. Obviously, a physical therapist would be somebody who can actually guide you through these things to make sure certain movements are safer than others and that you're doing things that are therapeutic and not causing things to be something that's poking the bear and getting it worse. I think I've told you before how I look at symmetry of the body,
Mhm.
see how we twist one way, how we twist the other way, how we raise an arm, how we raise a leg. Those kind of things will let us know where tension is pulling on each side of the body,
Mhm.
how you might be wound up tight in some areas. And so we work on a way to work your body asymmetrically to balance that out. And so that's a whole process I teach called total motion release. It's very helpful. Tom Delonzo Baker is a great physical therapist in North Carolina, teaches a lot of this stuff and teaches it to providers like me. I've done it for years and years, found it to be super effective to balance out the body. Has to be taught right. It's a little counterintuitive because you're used to kind of pushing into what's tight and trying to stretch what's tight. Actually, we're kind of going away from that. We're trying to move with where the body wants to go.
Okay.
Kind of like if you've maybe heard counter strain. Counter strain is kind of like if it's crooked, make it crookeder, they say. And
Yeah.
so it's something of that nature is kind of what total motion or TMR is all about, where you're going into the position your body likes to go in, and that helps you release areas that are tight instead of forcefully trying to like push on a muscle and kind of mercy hold it to
Yeah.
release, which can work too. I'm not saying it doesn't work, but the key part is keep trying things. If it's rolling peroneal nerve, it's doing footwork. All these things can be helpful, but you do have to kind of monitor what things are actually going to move the needle the most and actually help create lasting change versus just doing it for doing its sake and like
Right.
convincing yourself that it's better. And we want to make sure that things are actually changing things. And that's kind of why guidance from somebody helps you get
Yeah.
that sense of like, oh, okay, I can see how things are moving along based on the strategy and the process that this time and tested thing who's seen this before knows how to
Yeah.
do it. So
My favorite mottos to tell my clients is together we're our own scientists. So,
yeah,
don't do anything for just the sake of doing it and say if it's not working, do it more. I always track everything and I have them give reports to me of when they're doing things at home and always giving mindful feedback for the sensations. So,
yeah,
um, just the mindfulness in general makes you more aware of your body and helps you move in different ways, more correct ways if you're taught that. Um,
yeah,
but I love that the aspect that you were describing reminds me of a lot of new science that's coming out in understanding the fascial systems and everything. And the phrase I learned at the last convention was the way in is through the skin, and the fascia tend to remember really being treated with intensity, and they were saying that a lot of times it likes softer movements and like pulling away from the skin. And so in order to get like deeper into the musculature, we have to go softer. And
yeah.
so it seems counterintuitive because everybody loves that deep tissue massage.
Right. Just push it out. Let's dig it out.
Yeah.
And a lot of times that meets a lot of resistance. The
Yeah.
body's taking that as trauma and kind of resisting it and pushing back or trying to get away. It's a
Yeah.
gas or, like we say the three G's, like gas, grab, groan, like all these things kind of, we're trying to get away from it and the body's doing a reflex. So that kind of comes from some work I've done with called primal reflex release where we use reflexes to calm down the body and we try to watch those things where you're trying to get away lets us know kind of how to release those reflexes. And
Yeah.
then another thing I've learned, and I've learned a lot of things in almost 20 years of PTing, is uh, PNT, pain neutralization technique. That's by Dr. Kaufman in Denver. He's an acupuncturist, chiropractor, really brilliant person. Um, the release techniques just it just made me remind. I've done quite a bit of training with him, and yeah, the movement is just, literally just these little torques on it. I don't know if you had Bowen therapy before, but this is different than Bowen therapy. But like the idea is like you find different points and you might just do a little torque and a spread on a
Yeah.
certain spot. And then you'll feel for a primary area that might be sore. You might do a release here and then feel for that to release. And it's very gentle. And actually, a lot of people come into his workshops and they're pushing pretty hard. And he says, back that, start by just backing up maybe even 60% or more.
Yeah.
And then you can add more a little bit later as you go. But those techniques, there's a lot of things, and seek out people who know that technique. I definitely treat that with folks who need it more. Sometimes I'm just treating through motion because that seems to be the best way for a lot of my folks. But yeah, doing things that are gentler can actually be very powerful. But again, you have to bring it back to the result, what you're getting. So yeah, that's the key is like noting what's changing. What's nice about that release technique, pain neutralization is that you can be on the tender point, do a release somewhere, and then you can feel it turn off. And then you can repalpate, and it's significantly less as you're doing it. So you know you're in the right spot. So you're not guessing, which is nice. That it gives feedback to the client. Hey, that felt good. I
Yeah.
think they'll like that. And then we hold it there for the release to continue and then let it drain out and that kind of thing. So
Yeah.
really cool. Yeah.
That's yeah. Could that kind of technique be used with other forms of neuropathy, like the extremity weaknesses, or like we talked about earlier before the call, drop foot and things like that?
Yeah, so there's a lot of things you could, just a test. It's always comes down to a test retest type of thing. Anything like you said, we're our own scientists in a way. You do something, right? Anytime we're doing treatment, it's like, okay, we're gonna do something and test it, and then we're gonna do first of all test something, and then we're gonna number two do some sort of intervention if it's this technique or whatever, and then number three retest it, see if it changed in any way, and notice if it's better, worse, or the same. And then based on that result, you know what's helpful or not. If it's not changing much, doesn't mean you did the wrong thing. You might need to adjust it just a little bit, and that made the difference. Or you maybe need to do it longer or whatever. Or maybe more reps of something sometimes. So it just depends on what the results are, and that drives our decision making. And so, we've seen a lot of interesting things with these techniques, and especially like stroke patients, or the crossover body stuff really works really well.
Hmm.
So that's kind of where you're integrating the whole body connective tissue line to kind of
Yeah.
help create more awareness in your brain of what's going on. And that's been really helpful for folks who've had, weak extremities, they can't move their arm or whatever, and then they can start moving them. I mentioned Tom DeLonzo Baker.
Yeah.
He's done this forever. He's got some really crazy wild videos. If you want to check out his channel, it's Total Motion Release, and
Yeah.
he's been doing that for a long time. And he's had some pretty fascinating cases of him and other providers doing really amazing things.
Yeah.
But basically bringing people through a basic process. It's generally just a test and retest phenomenon, just seeing if it's changing much. And sometimes these things take time, but a lot of times you can immediately recheck it and see if it's better, which is really neat, when you can see that turn on and the body's doing better.
Yeah.
So,
Oh,
yeah.
that's amazing. You reminded me, I had back in Arizona, I worked with a chiropractor and a naturopath, and we had a stroke victim that was one of our clients, and he he was totally paralyzed on his left side. So, and that wasn't in my scope to work on the paralysis, but I was able to help him strength train on his right side. And then, but what we noticed after a few months was he got stronger and he was able to move. And my belief, just like we've stated over and over again, like our body's a system. So what we move on the right side, there's sympathetic movement on the left, and he started to get better tone in the left side. And actually, he'd been numb and paralyzed for years, but he got more tingling
Yeah.
sensations and he got more ability to feel on his left side.
Yep.
And it really reintegrated a lot of my belief that the more we move, the better even our broken parts can heal.
Well, yeah, that's not even belief process actually. That we know that when we volitionally kind of fire out one side, that there are contralateral
Yeah.
activations of the opposite side. That's not like hearsay or belief.
Yeah.
It's just like this is what happens, because there's certain that cross over, some that don't when we
Hmm.
do these things. And so these things are actually things that happen. And so yeah, and then anytime you're doing this, you have to stabilize in some degree of your core
Hmm.
muscles and that kind of thing. So yeah, it just helps the body kind of become a little more able to move. And usually it just comes through trunk coordination, that kind of stuff,
Yeah.
where we can kick on those muscles a little bit better. So
Yeah.
yeah, it's a really cool thing.
Yeah. And just a side note, that client, I did a lot of research and found that creatine is so good for stroke brains. And creatine's great to just for brain health in general, even with concussions and things. But that's just a side note. I did a lot of research for him, and he went back to his doctors, and they were like, "Yeah, we love this stuff, so you should take it."
Yeah. Well, it's
Yeah.
pretty safe stuff to take, and yeah, there's a lot of good stuff that you can definitely do, and you do what you can do. I mean, you definitely, as long as you're kind of in the range of like, hey, can help but won't harm.
Right.
There's so many things of that nature. Try not to get people too wound down the fact of just trying to keep trying, like they just hear something and they just do it. Like, look it up. Like, try to get more information on it. And I think that's part of it too. When somebody, because we also know placebo effect. If someone says, "Oh wow, this stuff. Oh my gosh, I've looked. I've read all this. Take a look at these videos." Like, we might find out some of these things that are, advertised on Instagram that are like complete, dust, they're just sawdust in a capsule.
Yeah.
But
Yeah.
like people are getting better because our powers, our minds are so fascinating. And
Wow.
so, but the more we can kind of read up on it, I feel like that's very powerful. So when I tell
Yeah.
people about something, I'm like, you educate yourself on it, and then you make the strong decision, like, hey, this really, you're convincing yourself, hey, this can be really helpful. And even if it is placebo, I mean, there's definitely parts in there that are helpful that, we try to do placebo-controlled trials and that kind of stuff. But like, hey, whatever you can do to put your mind into saying when you take something or you eat something or you're exercising, hey,
Yeah.
this is making me stronger, this is making me better. Yeah,
Yeah.
you're definitely putting yourself in the right mindset for yourself to move, or you're running up a hill, right? You're struggling, you're like, boy, this run's gonna make me feel bad, make me run faster. This is what I'm aiming for. I'm trying to get myself stronger. I'm getting stronger right now as I do my 15th rep of my press up or whatever, right? So all those things are, I try to make sure those parts are super integrated into what I teach clients. So,
Yeah. Well, that's awesome. Yeah, I love that. And one of my favorite go-tos when I'm trying to teach or have somebody do their own research is PubMed and a lot of the Harvard kind of peer-reviewed articles and things like that. Just so you get, not the snake oil salesman ads on Instagram and things like that.
yeah, yeah. So just like do your, research, look it up, see what comes of it. But then also don't be slow to act, like if you start to get paralysis by analysis because there are so many things. So, I think I heard Colin Powell say something about that with making a decision. Like you make a decision with maybe 70% of the information. Like,
Yeah.
sometimes you just have to act. Like, okay, I don't have all the information, but okay, I have enough to maybe like let's go do it. Like, okay, if I have this thought that it may work, why don't I try this and
Yeah.
go in on it? If it's,
Yeah.
some of the, compounds that, the peptides or whatever, these different things that are coming, good creatine, like generally if you know that the risk is small and they have an upside
Yeah.
potential, that's what you're trying to do. If you're trying to make a shift in your life and you're trying to get yourself better, you need to do something a little more dramatic than just a little subtlety thing like, oh, I'm going to eat peppers today,
Yeah.
like is that going to change much? Probably not, right? So like can you do something that, you've looked at, there's enough people kind of creating enough you know, kind of proof in the pudding of like what they're saying is happening, their experiences are good, that we can kind of rely on that now a little bit more. That's not just somebody just trying to sell something, is you can kind of look across, several people doing things, different brands or whatever, and seeing what happens, and then do your research, but then don't just keep looking and looking and just get lost in the research web. Just make a decision, see how you do, set up some sort of experiment for yourself. Hey, I started doing this thing on this day, and how did things change? Did they actually change or did they not? So,
Yeah.
acting like a scientist, like you said.
Exactly. Just I love that. Yeah.
Yeah,
Especially if you're beating the research, but you can do your own research on your own body and then keep track of all of that, and then you're a scientist. Uh,
yeah.
well, that's awesome. I have one quick exit question for you. I know what your answer is going to be, but as far as the neuropathy aspect, it is changeable, right? You can heal slightly from it, fully from it. What's your thoughts?
So, it just depends on the severity, right? So, if we have a certain degree of loss in neuronal, there's certain neurodegenerative conditions that can progress, and then there are definitely ways for our bodies to recover and re-energize. But, what I've recognized over many years is that how we have a certain pattern in our lives and our things that we normally do, there has to be this huge shift to do something into a healthier pattern. That's when you see these night and day changes, that like they did something dramatic with some sort of treatment or modality, some sort of like new treatment that's more cutting edge, or something that was really going to change it on a higher level. That you have, if it's red light and they did a higher intensity or those kind of things, that's what I would recommend. Things that you would try to do that are full in on the opposite of what you were doing that got you there. But a lot of people don't, right? So they just continue to go down a path and eat the same things. They have the same habits and movement. We got to get past those things. And then the potential of anything is really powerful to actually make those shifts happen. But then we got to expect that neuron regeneration takes a long time, that we have to be persistent on it. We may not see much shift right away. It doesn't mean it wouldn't be happening. And so it's just like, growing a plant, on the seed, you don't see anything happening. And then all of a sudden it sprouts up and, things were happening, but you didn't see it. And
Yeah.
so we have to be aware of those kind of things. But, for people who kind of have, low to moderate, those things can be resolved. When it's higher and more involved, can they be abated? There's no doubt that it can be possible. And to just try not to surround yourself with people who saying, oh, that's just the way it is, and that's just going to have to be that way. But then again, you also have to understand you can get better even if you are severe, but like there have to be a huge shift. Like you can't
Yeah.
just, like I said, I can't just put a little red light on there and do that every day for 15 minutes and then expect that to be the thing. You,
Right.
you would want to work on all the things, as
Yeah.
many things as you can do to make that shift and to be intentional about it. And then even with that, not to be so, I heard this really cool statement. It's from A Course in Miracles, and it said, for faster results, try infinite patience.
Oh, I like that.
I absolutely love that
Yeah.
because that's the thing. What a lot of people are expecting, this is this culture we're in. We're trying to get something done fast, and we want the results and we want it now and we want it yesterday.
Yeah.
And the thing is, it's just never really that way. We have to be patient with it. But the paradox is, the more we're kind of like, okay, if it happens, okay, if it doesn't happen,
Yeah.
those things tend to happen a little quicker and sooner, and then it's like a delightful surprise, and it's just a nice thing that happens. A lot of people are, they're trying to have this happen, and like, if this doesn't happen, then I don't know. And that's just putting too much pressure on things coming your way. And
Yeah.
so I try to train more of my folks who come in to see me that, the more you can kind of just be like, it's okay if this doesn't. It's kind of a weird thing to say, but like, are you okay if this never gets any better?
Right.
Like, that's a weird question to
That
ask
is.
somebody. But
Yeah.
also, by them releasing from that, they tend to get better.
Yeah. Yeah.
So, yeah.
Awesome. Well, thank you so much. I know we went kind of all over the place, but I love where we went. And so thanks for geeking out with me on neuropathy. But I've gotta go now. So I will
Okay.
put this out. This has been Healthy and Active in the Couve. Thank you so much, Trent. It was a pleasure. And again, if anybody has more questions, I can leave our information on the websites that we broadcast to. Feel free to ask us anything. And if you want more topics, ask us any topics that you want us to bring up, and we will try to research those if we don't already know them and have fun chats. But thank you so much.
Awesome, Nick. Thanks so much. It was awesome. Good talk. All right. Thanks.